Discussing how peripheral vascular disease is treated is heart-centered cardiologist Dr. Michael Yen. Dr. Yen, how is peripheral vascular disease treated?
Peripheral vascular disease is treated by a multitude of ways. Number one, we want to control your risk factors for peripheral vascular disease. So if you smoke, we want you to hopefully stop smoking. If you have diabetes, it has to be well controlled. Hypertension has to be well controlled. Cholesterol levels have to be well controlled. And then it really depends on how bad the peripheral vascular disease is. So of the legs, if you have mild claudication, which is mild pain with walking, sometimes we just use a walking program as well as a serial testing to make sure that the peripheral vascular disease is not getting worse. And that would be the ABI-PVR test, which I described previously, measuring blood pressures in the arms and legs, and a walking test to see every 6 months to a year whether or not that's getting worse or if your symptoms get worse. If your symptoms really bother you and affect your daily activities, then we become more aggressive with the peripheral vascular disease management. Or if you have evidence that you could have what we call limb ischemia, which is basically when the leg is not getting enough blood flow at rest or with minimal exertion, then we want to be more aggressive, because the most devastating consequence of peripheral vascular disease of the legs would be rest ischemia and or need requirement for amputation. So generally speaking, we want to prevent that before it gets to that point. So we want to treat this disease very seriously. In that situation, we usually recommend angiography, which is peripheral angiography, which we do in the hospital. We usually get a CT scan first with contrast if possible, if your kidney function is normal. And that will plan our subsequent tests that we do in the hospital. It also reduces the risk of the procedure, so we'll know a little bit up front where the disease is. With peripheral vascular disease that's very severe, we can sometimes treat it with balloon angioplasty, sometimes with stenting, and sometimes with vascular surgery, where they do a bypass surgery to bypass the blockage that's there. But I want to emphasize that medical management is the all-encompassing part of this. Regardless of whether or not we treat you medically or whether or not we go a surgical route, good medical management, control of risk factors is paramount. For carotid disease, if you're asymptomatic, you have no history of stroke or TIA, and you feel well, we usually do not intervene unless it gets very, very severe. And most societies would suggest a stenosis or blockage greater than 80%. One could consider potentially surgical revascularization, and that would encompass carotid endarterectomy, which is the standard approach, where one does a surgery to fix the blockage, clean out the blockage, and then subsequently sew up the carotid artery afterwards. Or sometimes we can use carotid stenting in a small subset of patients currently. For asymptomatic stenosis, it's still risk factor management, stopping smoking, control of diabetes if you have it, control of hypertension, and control of cholesterol. Usually we recommend antiplatelet agents such as baby aspirin and so forth. If you're symptomatic, if you've had a history of a recent stroke or transient ischemic attack, then we are much more aggressive with carotid revascularization. The data would suggest that those patients should get prompt evaluation for possible endarterectomy, which is a surgical cleaning of the blockage, or possibly a carotid stent, which is placement of a stent in the catheterization lab to fix the blockage. For the kidney artery, generally speaking, we reserve treatment for that, which is usually angioplasty or stenting in patients who have very poorly controlled hypertension or worsening renal function or pulmonary edema or fluid in the lungs of unclear etiology. And generally speaking, we do that in the catheterization lab, where we will subsequently do an angiogram to confirm the stenosis, and subsequently either balloon angioplasty or stent the blockage that's there. But once again, you want to have good medical management of your risk factors for that as well, which is usually the common factors of smoking, hypertension, diabetes, and cholesterol control. Peripheral vascular disease is important to recognize and diagnose, not just because patients sometimes have symptoms from it, but the main goal of diagnosing peripheral vascular disease is we know that once it's diagnosed, your chance of having significant cardiac problems down the road, which will include heart attack and or stroke, rises substantially. And so it's important to identify these patients, because a lot of times patients might not have any cardiac symptoms whatsoever and be diagnosed with peripheral vascular disease. Once that diagnosis is made, we concentrate very importantly on focusing on the cardiac evaluation as well, because we know a lot of patients with peripheral vascular disease will also have concomitant cardiac disease, which has not been evaluated for yet.
Can you discuss mesenteric ischemia?
Mesenteric ischemia is disease or blockage of the vessels, usually to the bowel, the small intestine or large intestine. sometimes rarely also to the spleen or to the stomach arteries. It's usually diagnosed by history. Patients will usually complain of discomfort or cramping, severe cramping after eating, and this can be very hard to diagnose because some people think it's heartburn or just something that they ate. But usually this is predictable over a period of time where they get severe cramping, and then sometimes we will get a CT scan or MRI with angiogram to diagnose that. Treatment for that usually is supportive because the surgical treatment for this is sometimes quite extensive if needed to be done. However, though, if patients are very symptomatic from this and their quality of life suffers, then subsequently we recommend surgical bypass and sometimes stenting in rare circumstances.